Hello and welcome to Wellness Wednesday. I'm James Currie with the Communication Department at MCHD, and I'm talking to Alexandria Marshall. She's an RN and she's also a doula. So we're going to talk about what a doula is. Alexandria, how are you?
I'm doing well. How are you doing today, James?
I'm fine, thank you. So we've just introduced a new word into a lot of people's vocabulary. So let's tell people on Wellness Wednesday what a doula is.
So, a doula is a trained professional that provides emotional support, physical support, and informational support prenatally, during childbirth, and postpartum. So, just being that support person during childbirth.
And doulas have been around for a very long time.
Yes, a very long time. We're just getting back to it. We kind of veered away from it for a minute.
Yeah, but it's an important position. So most people may not be familiar with doula, but they're familiar with a nurse midwife. So talk about that, the similarities of the two positions.
So both offer holistic approach to pregnancy. Midwives are trained healthcare professionals. So they follow you throughout pregnancy, provide care, diagnosis, treatments. They can actually deliver the baby. Some midwives can deliver in the comfort of your home or deliver at a birthing center, whereas a doula is holistic support but emotional. They are not healthcare providers. So just being that support person with you for if you have a midwife or OBGYN at delivery.
Mhm. So you can expect a doula to be in the delivery room with you.
Oh, yes, absolutely. In the delivery room, going through every contraction with you, just kind of encouraging the mom to push forward, that she can do it, changing positions, breathing techniques. So, yes. And once baby's here, helping with breastfeeding and just that transition into motherhood.
And that's great because that's not where mom's mind is right now when she's, going through the contraction. So to have that person that has that experience to be able to help them get in that comfortable position that they're not thinking of. So yes, that's definitely a vital service. Um,
Yeah.
so, let's talk a little bit about the statistics part of it. So let me make sure that I get this correct. So Alabama has one of the highest rates of maternal mortality in the nation. Um, so why do you think doulas have been important in helping to decrease this?
So again, just having that continuous support. Alabama, a lot of insurance companies do not cover doula services, so it's another out-of-pocket expense for moms. So again, we kind of steer away from it. But if you go to, New York and Texas, where some insurance companies are covering it, it shows that doulas are evidence-based and they help decrease cesarean rate, decrease the need of pain medicine for moms that want to go natural during delivery. They help create that positive birth experience. So, Alabama having a doula is very important to help those numbers come down with the maternal mortality rate as well as infant mortality rate.
Now you've got some statistics there. Um, can you share those numbers with us?
So the CDC reported that Black women are 3 to 4 times more likely to die, excuse me, of childbirth complications than their white counterparts. And that's just due to healthcare disparities, diabetes, high blood pressure, heart disease, having a lack of access to proper medical care, just dealing with the lack of support in general, racism, being treated differently throughout pregnancy. So that is alarming, very alarming, especially for Alabama to go into the hospital to have a baby, a happy and joyous time, and for that baby to return home without a mom is very unfortunate.
It is, and those numbers are staggering. Which brings us to why we're speaking right now.
Yeah.
So, April 11th through the 17th is Black Maternal Health Week.
Yes.
And can you talk a little bit about the history of that and, you know, especially, well, you kind of went over a little bit why it's so important specifically for Black mothers, but a little bit about the history of how Black Maternal Health Week came about.
Yeah, so Black Maternal Health Week was founded by Black Mamas Matter Alliance. It was started to bring awareness to the alarming numbers with maternity and Black moms during pregnancy, to serve as activists in the community, just showing this week and try to help the voiceless have a voice. So everyone supporting Black moms, helping, being encouraging, and just that community outreach with OBGYNs, physical therapists, nutritionists, internal medicine to just come on board and just help increase those numbers and have better outcomes, better birthing outcomes for Black women.
And it's important to have these breakout weeks where you just, spotlight and focus on one particular health instance or health disparity. So I'm very thankful that you're here this week, especially for this week.
Yes.
So let's talk a little bit about your background and your history. You're an RN, so how long have you been doing that?
Yes, I am a registered nurse. I've been a nurse for 10 years. I started off in labor and delivery, worked a little bit in mother baby. My partner, Shapay Allen, she has experience in lactation, infertility, and high risk OB. So we provide services to a range of moms and just providing that individualized care. You can Google during pregnancy, but for someone to have the knowledge and to see someone that's gone through something like you, to be able to refer things to her or make suggestions. Mama Bloom, not only do we help the mom, but we help families. We provide childbirth education in your home. So your support person can be there, grandparents, and things like that. And so I started Mama Bloom because so many people came into the hospital lacking the education and support that they needed to have, I feel, a positive birth experience. So we created Mama Bloom just to help moms be there by their side, just providing that continuous support to help them make informed decisions and know their birthing rights and just to advocate for themselves during this process.
And you mentioned, your company, Mama Bloom Doula Company. So
Yeah.
you've been a registered nurse for 10 years. Now, Mama Bloom has been around for how long?
2 years, 2 years. Yeah,
Two
we're still
years.
in the growing process. Yes.
Uh-huh. So let's let's tell the viewers how to contact you, how to contact Mama Bloom for more information, because we know that's one thing that you can count on in this world. There are going to be pregnancies, right?
Yes, yes. So Mama Bloom, you can find us on Facebook or Instagram at Mama Bloom Doula. We provide services in Mobile and Baldwin County. You can ask your OBGYN or your midwife, like, should I really get a doula? And I'm telling you, they're going to say yes. We have a great relationship, especially with USA Health. And our services are private pay. You can ask your insurance company if they cover our services. We do have an NPI number for that. And if you are 24 years old or younger, you can get Mama Bloom Doula services free through the Mobile County Health Department.
Which is why we're speaking today.
Yes.
And we're so very thankful for that partnership, and we know that that is just such a critical time, and
Yeah.
especially at that age, it's such a critical time in a young mom's life. So we're just so very, very thankful again for the partnership and for the expertise that you help partner with us and bring, to bring light to this service.
Yes, thank you so much.
Well, thank you so much for being on Wellness Wednesday. So again, I'm going to mention the name of your company. It's Mama Bloom Doula Company, and we'll put all of the links to all of your contact information here along with the show notes. So, Alexandria, thank you so much for being on Wellness Wednesday here at the Mobile County Health Department.
Thank you.